Hello everyone, I am Dr. Prabdit Singh, MD Anatomy from AIIMS Jodhpur. So in this video, we'll talk about maternal pelvis, and I hope you're enjoying the previous videos. So इस बारी बढ़ने से पहले I would like to request कि please like, comment, share and subscribe to my channel. Share with your friends, those who are pursuing MBBS या फिर जो FMG exam दे रहे हैं या फिर जो NEET की तैयारी कर रहे हैं, NET की तैयारी कर रहे हैं, you can share it with them, or you can share it with your peers from other colleges of MBBS. So let us talk about the pelvis, the pelvimetry. Pelvimetry is very important topic because anatomy के अंदर कोई पढ़ाता नहीं है, ठीक है. एंड अगर आप देखो तो एग्जाम्स के अंदर ये बहुत पूछा जाता है, बी इट एनी एग्जाम, बी इट एनी नीट, एफएमजी, एमबीबीएस के एग्जाम, कुछ भी हो. गायने के अंदर we also study this mainly in gyne, right? But not in anatomy. So I'm trying to incorporate the gyne wala thing also with the anatomy. And let us talk about the pelvimetry. So let's begin. Pelvimetry is also known as the maternal pelvis. So the maternal pelvis is divided into the true pelvis and false pelvis. False pelvis is the one, the upper part of the pelvis जो कि आपका सारा का सारा ilium से होता है, and true pelvis is the real that is having the cavity. So we will talk about the true pelvis. So you can imagine that the pelvis is like a glass. So it has an inlet. Oops. It has an inlet and anatomical outlet. Apart from that, it has a cavity. Then over here you have the obstetrical outlet. So the cavity extends from S1 to S4. Obstetrical outlet is from S4 to coccyx. Now, in this, we have two more things: the plane of greatest pelvic dimensions and the plane of least pelvic dimensions. So the plane of greatest pelvic dimensions is over here. So this is a plane of greatest pelvic dimensions, GPD. It is at S2, S3. Then you have the plane of least pelvic dimensions over here, LPD, that is L4, L5. Sorry, L4, L5 कह रहा हूँ, S4, S5. Okay. So we'll talk about inlet, cavity, obstetrical and anatomical outlet one by one. So the inlet. So the boundaries of the inlet, anteriorly you have the pubic symphysis, that is the superior border of pubic symphysis, and posteriorly you have the sacral promontory. So let us have a look over here. So you have this image. This is over here. This is your pubic symphysis. And over here, this is L5, L4, S1, S2, S3, S4, S5. This is your sacral promontory. So from the upper border of pubic symphysis, we measure. From the lower border of pubic symphysis, we measure. And from the posterior surface in the middle, we measure. So I'll just come back to these in a minute. Before that, I would like you to note something. The dimensions of inlet. Be it inlet, cavity, outlet, it is measured in three ways: transverse, oblique, and anterior posterior. So transverse diameter in inlet is 13 centimeter. oblique is 12 and anterior posterior it's 11 centimeters. Just remember these and let's see how it goes. Okay. So and anterior posterior is further divided into three: the true or anatomical, that is 11 जो मैंने यहाँ लिखा है, ठीक है. Then comes your obstetrical, that is 10. Then comes your diagonal, that is 12. So out of the three, in reality, in real patients, manually you can measure the diagonal anterior posterior diameter. So how are you going to measure it? So from the lower point of pubic symphysis to the sacral promontory, the one that I'm drawing in yellow, this is basically your diagonal. Then the one in the middle that you see from the center of pubic symphysis posteriorly to the sacral promontory, this is obstetrical. And then from the upper border of pubic symphysis to the sacral promontory, it is your anatomical. That's how it is. This is about the inlet. I hope itna clear ho gaya hoga. Then let us talk about the cavity. So cavity is the part of pelvis that is bounded by the inlet superiorly and inferiorly by the plane of least pelvic dimensions. So the plane of least pelvic dimensions is basically forming a partition between cavity and obstetrical outlet. Cavity and obstetrical outlet. So cavity superiorly it is bounded by inlet and inferiorly by plane of least pelvic dimensions. So what are the dimensions of cavity? Dimensions of cavity, again we measure it like anterior posterior, transverse and oblique. And over here every parameter is 12 centimeters. चाहे आप कोई भी ले लो, ठीक है. Every parameter is 12 centimeters. Now important point to note, the plane of greatest pelvic dimensions is the part of cavity which lies at the level of S2 S3 junction. The cavity is from S1 to S4. That is about the cavity. Now let us learn about the obstetrical outlet. So obstetrical outlet is basically the lower part of pelvis below the ischial spine. So in order to understand that, we need to understand firstly the least pelvic dimensions, the plane of least pelvic dimensions. So we know that over here we have in pelvis ischial spine. So the plane at the level of ischial spine is the plane of least pelvic dimensions. I hope that is very clear. The plane at the level of ischial spine is the plane of least pelvic dimensions, because if I draw at the level of ischial spine, the transverse diameter is only 10.5 centimeters. This is also known as the bispinous diameter. This is at the level of the two ischial spines. Anterior posterior over here is 11 centimeters. Then you have the posterior sagittal, that is around 5 centimeters. So over here you have the sacrum, and from the sacrum to the bispinous, if I draw a line, that is your posterior sacral, and this is 5 centimeters. This one has to be around 6 centimeters. Diagram is not to scale. So if I write down the dimensions of cavity, in cavity I have anterior posterior 11 centimeters, sorry, not cavity but obstetrical outlet. Transverse is 10.5, that is your bispinous. Oblique is again 12, and then I have posterior sacral, or it is also known as posterior sagittal. This is 5 centimeters. Now the last topic about this video, that is anatomical outlet. Anatomical outlet is the real outlet of the pelvis that is bounded anteriorly by the inferior border of pubic symphysis to the tip of coccyx. So if I have to draw it in this diagram, the one that you are seeing over here, this is your anatomical outlet. So from the lower border of pubic symphysis to the tip of coccyx, that is anatomical outlet. So what are the dimensions of anatomical outlet? Transverse, anterior posterior, oblique. Oblique as always 12. सो इनलेट का जो था ट्रांसवर्स और एंटीरियर पोस्टीरियर वो यहाँ पर रिवर्स हो जाएगा. इनलेट में ट्रांसवर्स वाज 13, सो ओवर हियर एंटीरियर पोस्टीरियर विल बी 13. इनलेट में anterior posterior was 11, so over here transverse will be 11. So that's all about anatomical outlet, and that's all about the pelvimetry. I hope you guys are enjoying. So don't forget to comment and hit the bell icon. उससे ज़्यादा पूरी वीडियो देख के जाया करो. Bye bye.